Hey, good evening, everyone. Tonight we will be live with Dr. Sam Shamardi, and let me invite him to join. Um, Works. Hey, Dr. Shamardi, how are you?
Hey, how you doing?
I'm good.
Good,
Hey,
man.
well, it worked pretty well. We got connected without too much delay, so
Yeah, we're in. We're in.
I feel like the app changes a little bit every time I do one of these, so it's always a little bit.
You honestly, you never know. It's like you never know what's gonna happen, but it came through.
Awesome. Well, hey, thanks for taking time with us this evening. I'm gonna do a real brief intro and then let you introduce yourself a little bit more to the group. So, Sam Shamardi, you're a periodontist. You practice in the Boston area. I know you do some teaching at Harvard. You also do some other coaching and mentoring. But maybe you could just give us a little bit about your background and then what do you do today? Where do you practice? Any clinical focus, et cetera?
Sure, sure. Well, yeah, I mean, you hit the big points. Practicing board certified periodontist. Been practicing now for about 15 years, and from Southern California, but lived out east for about 20 between dental school out here at Tufts, residency at Penn, and just practice the last 15 years. And as mentioned, yeah, work still full time, teach at Harvard Perio. Been there for almost 14 years now, 13 or 14 years with the PG Perio residents. And outside of that, yeah, really involved on the speaking circuit, doing a lot of lecturing, obviously all things perio, but I think you're interested in hit on some of the other stuff in regards to finance, hearing loss, mental health. There's a lot of stuff outside of just the clinical dentistry world that I'm really passionate about because as a dental professional, regardless of what specialty or whatever you practice, there's so many other factors that make or break our careers outside of the next composite or whatever else it might be. So those are the things that really are more influential to me, and that I'm really making a big effort, aside from perio, to try and spread the word and educate everybody on.
Yeah, well, perfect. I think that's a good segue. So yeah, I mean, we work with a lot of periodontists. Periodontists do a lot of dental bone grafting. Osteogenics is really focused in the dental bone grafting and soft tissue grafting space. And I know you use our products and you do a lot of this in your day to day as well. But you also have a lot of interest, I think, outside of just the normal, procedure and products and things like this. And I think that's something that I think is interesting and is maybe where we'll take some of the discussion tonight. I know I, I was able to sit in and listen to a lecture recently that you did on mental health. I thought it was really good and enlightening in some areas. I mean, we know that dentists struggle with mental health for, I think, a variety of reasons. It can be a lonely profession. Hollywood doesn't always portray dentistry in a positive manner, which often sometimes seems unfair. And then there's a lot of other sort of challenges as well. And then I feel like in the last week, especially on Instagram, which is, obviously where we are now, there's been a lot of additional sort of like awareness around mental health with with some tragic situations, things like that. And so maybe we could jump into the mental health. It's like, what is the cause, and then what can we do about it?
Yeah, it's a really big topic. It's something that I'm really happy that it's getting a lot more attention. The amount of conferences I'm at now, I was just in Buffalo 2 weeks, 3 weeks ago, speaking at the conference there. They wanted that as one of the topics. So the fact that instead of doing surgery stuff, they're wanting to speak on this just shows how much this topic has gained interest, which is really important. At the end of the day, dental professionals, there's always been that stereotype and myth of deadness and suicide, and unfortunately, you look at the literature there, and we're number one by a long shot compared to other fields.
Wow.
You hit on some of the stuff behind it. We're a very isolated field. There's always a pretty negative environment and stigma. There's a lot of kind of, compassion and what they call compassion fatigue through years of just having to absorb patients' negativity while still having to try and stay positive and reassure them. So there's a natural just fear, and there's a lot of stuff involved in that. And, ultimately, our environment is extremely small, and we're perfectionists. We're very driven type A people. There's not many fields out there that, a quarter of a millimeter is the difference between perfection and complete failure. So there's a lot of added pressure and stress that we have on us for our clinical outcomes. We're perfectionists in a lot of ways. And so, from the clinical side, from our own kind of drive and how we were educated and the standards that, we had set on us growing up to even get in, and then, within the profession itself, then you start throwing in the patient expectations and their, kind of side of things. And then just, the wear and tear over time. I mean, at the end of the day, we suffer from burnout. We don't get enough sleep. We have 93% of us with multiple forms of musculoskeletal issue. We physically break down. All of these things at the end of the day are cumulative. And it doesn't matter how healthy or, in shape you might have been when you were younger, you start adding up lack of sleep and extra stress and all this stuff one time over another. And it's literally just a matter of time before this stuff starts to, catch up to you and take its toll.
Yeah, that makes sense. By the way, for the group that's joined, if you guys have any questions, if there's a kind of a question with a speech bubble, it's in the bottom right of my screen. But you can type it in there, or you can type in a comment, and we'll be looking for those and ask Dr. Shamardi some of these questions. So you talked a little bit about the stresses that dentists and periodontists and other specialists are under. What can we do about it? Is it do we have solutions, or is that really an area where we still have a lot of work to do?
You know what? There are solutions. Fortunately, there are solutions to everything, but it's really it's part of it's just seeking it. It takes a lot because we're so overstrained from our schedules, and we've got so much pressure on us and overhead and late hours and emergencies. We always put our patients and the business first. And then obviously for those who've got, family and other responsibilities, it's like bottom line is it's always about everybody else except, us. And so that's really difficult. But at the same time, without us being in a better state, both mentally and physically, we're not able to then give back and provide that opposite way. So there's this balance that is tough. So certainly, and we speak about this a lot in terms of, solutions from the mental health side, just the discussions of them, different exercises, whether even be, breathing, mindset exercises, which, I'll be frank, a few years ago, I would have laughed that off and been like, this is ridiculous. But even doing it to a small degree, it's made a big impact. I noticed a noticeable, change. From the physical side, there's ways to seek out a trainer to get some targeted specific exercises that'll help, get your core, your back. I mean, everybody, it might be your shoulder, it might be your lower back. There's so many areas physically that we have breakdown for, but there's ways to kind of, strengthen that. And so bottom line, whether it's, physical and mental side, one thing you'll know is that all your colleagues, even though it's not really spoken about much, everyone's going through that. So you have a big environment. And I think the more that, like you noted, this is becoming a more popular topic, and I'm getting asked to speak about it more along with the few others that do. It's just proving that model, and it's allowing people to be a little bit more, comfortable about having an open discussion. And that's really where things start.
Yeah, makes sense. Do you think that, corporate dentistry has really, post, during COVID, post COVID, I feel like it's really sort of, I don't know if exploded is the right word, but it's really like, it seems like it's becoming more and more of a thing in dentistry, and is kind of shaping a little bit. Do you think that, and this is just a question that popped in my mind, I don't have any agenda around it, but do do you think that being part of corporate dentistry is it could help this or make it worse? I think on the one hand, I think, okay, maybe if you're not in charge of some of the business stuff and some of the purchasing and negotiating, like, there are some nice advantages of being part of corporate dentistry. On the other hand, there's also pressure around production and profitability. So like, I just wonder, do you think that that trend could help make this better, worse, or probably the same with just trading one issue for another?
Yeah, yeah. No, it's a great question, and it's a reality of the field now, right? No way to avoid that. But I think, ironically, like everything else, there's pros and cons. So you pointed on some that could be seen as a pro. So for those who, we just talked about the stresses if you're somebody who owns practices and, have plenty of colleagues that own multiple, and that puts a tremendous amount of strain and stress on them. So sure, you take that burden off the shoulders, and there's a lot to be said on that, from a positive standpoint. At the same time, we talked about, dental professionals being more type A, wanting things a certain way and kind of having a way of doing things. Well, one thing the literature's found that we speak about is that when you are a part of more of that type of an organization, you don't have any autonomy, because now instead of doing things, with the equipment you want or maybe the way you want, you're instead doing everything based off of what a specific group or a company wants you to do. And if it's something that falls along the line of what you follow and believe in, well, now you've got synergy and it's great. But if it's something that maybe doesn't, now you're in a little bit of a spot where you're like, I don't know how much I'm in with all this, but it's who I'm working for, and it's what I got to go forward with. So there's definitely some parts of it that could be really good, and then other parts of it that could be a little bit more stressful
Yeah.
and more burdensome.
So maybe the jury's still out a little bit in terms of if it'll have any impact on mental health in
Yeah,
general.
I think, one good thing that those DSOs corporations can do is, as an organization, they could be, bringing these types of topics there.
Great
They
point.
could be providing education behind it. They could be, even more importantly, not only providing the education, but providing solutions for it.
Yeah. Yeah.
Mentorship groups, people that you can talk to, all the other things we said in terms of exercise or whatever it might be. I mean, so that's actually a great opportunity for those organizations to actually be, leading that. And I've certainly tried to speak with one or two in regards to that and to help kind of contribute to that. But it's all about that, excuse the pun, but the mindset of that, organization. But I think the way this is trending and the way people are talking about it a lot more, I would think with time, it's something that's going to start coming up because it's just becoming too prevalent.
Yeah. Okay. Shifting gears a little bit, you also do a lot of speaking on finance, retirement, etc. So maybe you could just talk about a little bit, what are, for our audience, and by the way, for the audience, if you guys have any questions, feel free to put them in the comments or the questions, and it would be we'd love to get your questions answered. But so for finance, for people in different places in their career, we've got dental students and residents just getting out into practice.
Yeah.
They may be going to join a corporate dentistry like a DSO, or they may be going to private practice. They might start up their own practice, or they might join a practice. And then you've got some that are, trying to figure out, what's retirement going to look like? How much do I need? When can I do it, et cetera. Just from a using your finance background, like what are the most important things you think our audience should know, maybe at various stages in their career?
Yeah, it's a great question. Something I addressed during COVID. Because we were off clinic for a while, I published a book on that, financial survival guide for dentists. And, it depends where you are in your career. So you look at the new grads and, my residents now who are graduating Harvard between residency and dental school. I mean, these guys are getting out with 750 in debt.
Wow.
And, what's essential from the finance side is you're not really aware of running a business. You're not aware of what a corporation is, what a write-off is. You know that you have to get insurance, but you don't know what type. You don't even know that there's different types and what's involved. And for something like disability, for example, not having the right policy, the right writers, and knowing what questions to ask is huge. In the last few years, the amount of colleagues between injuries and health stuff that's come up, you get put in a bind, and if you're not prepared with the right policy, I mean, you're really, handcuffed by that. So that's kind of more what you see for that earlier age, and then more of kind of the mid career and further, the focus is how are you kind of being able to set yourself up for success in retirement? Did you start early? Have you started putting away and been very disciplined from day one? People don't realize how massive a difference if it makes to start, right off the bat. We think, well, we're not earning that much, we can't contribute much, but even a tiny bit early, you're so far ahead because of the way kind of just the market and the growth curve goes. So the way things compound. So it's really more about starting early, and then really, setting yourself up. We just segued from the mental health is also how are you going to keep yourself in the game long enough? If the average career is 35 years and after, 8 to 10 years, you're feeling the burnout, well, how are you going to go another 25? And that's where that whole conversation comes in with, what are you doing to, take care of yourself from the mental side? What are you doing from the physical side to help you be able to withstand the physical side and prolong your career? Are you taking little, mini breaks, weekends, et cetera? It might be. You got to kind of set yourself up for success like that.
What do you think is the number one mistake that people make? And that's it's kind of a heavy question. Maybe there's a different way you'd prefer to frame the answer, but like, if you're just one thing that people could change, like, what would it be?
As like a new grad or just in career or?
It's a great question. I don't know which way is the better way of thinking. Like,
Yeah, I
either.
mean, I think one side is one, seek guidance. At the end of the day, people you work with, you'll know, mentors that you have or other colleagues who've been doing it, 30 years, be a sponge around them. Ask them. Obviously, times change. Look at how much technology and software has changed and all that. That's fine. But in terms of just the business side, the day to day, some of the guys I've worked with, men and women both who've been doing it for decades, I look at them sometimes. I'm just like, how on earth are you doing this with a smile and still lasting? Like, what's your secret? Learn. So I think that's probably on the surface kind of the most valuable thing is just, seek the guidance, ask the questions, realize that everybody's in the same boat. So, your experience might seem really kind of unique to you, but once you start having that discussion with others, you start seeing how actually, how many more people are saying the exact same thing as you.
Yeah. Okay. Um, Pivot a little bit to, I know you also, and this gets a little bit into mental health and just kind of like overall, just like
Yep.
well-being. Um, the hearing loss part, you and I were talking about on a pre-call earlier, just a little bit about this topic. This is something that I was not as aware that dentists like suffer from or sort of uh, an issue. So talk a little bit about, but whenever you explain it, it makes perfect sense. So describe this hearing loss problem, and then also, what should we be doing about it to prevent it, et cetera.
Yeah, unfortunately, dental professionals don't realize, but our profession results in us getting hearing damage, and it's something for about 13 years now. I've been speaking about nationally, globally. This is a really kind of passion project of mine. We don't put two and two together. You think your hair is going to gray naturally with age because that's just what happens, and we don't realize that in our field, every piece of equipment that we use in the dental operatory, literally every one of them is above the permissible level for hearing. So as a result of practicing, it's literally just a question of how bad and to what degree you're going to lose your hearing. So it's not only something that's, it's one of your five senses. So if you think of PPE, we wear eye protections because we got to protect our sense of sight. We've got masks on because we inhale a lot of, chemicals and fumes, and we got to protect our, sense of smell. All of our senses are to some degree or other protected, but when you look at your sense of sound, there's no regulation, there's no protection. And yet again, all of this equipment that we work with directly results in permanent and irreversible hearing damage. And then just to add insult to injury, people don't recognize that the high noise exposure leads to systemic health issues also. So there's actually direct links with long-term high level of noise exposure and things like cardiovascular disease and stroke, diabetes, for females, low preterm weight, birth baby. There's just so many.
From the noise or from some other aspect of it?
Yeah, from the noise, because as a result of that noise, you always have this triggering of your endocrine response, fight or flight response, change in short term for hormones. And basically what happens is that happens every now and then. That's not a big deal, but that starts to happen more consistently because of, the exposure you have, and it starts to reset your system. And now you've got this endocrine system that's just hyper alert. Your fight or flight is active far more often, and that starts to change our cortisol curve, and it changes everything within your system. So yeah, it directly results. So it's bad enough that the instrumentation and all of our equipment is making us go deaf. That's already as bad as it gets. But now you start throwing in the systemic side, and it's really critical for people to recognize that. And so been educating on that, created a solution, a hearing loss product that would allow you to still communicate with your patients and staff. That's the big thing, is we don't put plugs in our ears because you can't communicate, you can't hear anything anymore. This was kind of an advanced electronic hearing protection. Would allow you to communicate with everybody as if you had nothing in your ears, but that high level of decibel and frequency noise, like the high speed, for example, you could put that right next to your ear all day. It's not going to be loud. It's not going to cause that aggravation. You don't have that shrill, which means you're not getting that endocrine response, that fight or flight, jump, and you're not going to damage your hearing. So it's just a matter of, like everything else, there are solutions there, and it's completely preventable if you're aware of it, and if you actually seek the protection for it.
What is this hearing loss product called?
So when I had originally launched it, it was called the DI-15, and the last few years it's been known as Ear Aid. And I've worked with a couple distributors over the year. Good and bad news. Good news is that we had it around for many years. We ended up selling through all our product. That's great. The downside is now I'm in the process of trying to get a new improved iteration going. Actually, the main group's out in Texas, not too far from you, where you are. But per usual, dentistry is a small piece of the pie. So it's trying to, get these companies to be like, yeah, we're not a big subset of the population. We're not manufacturing and medical, but, we need this in a lot of ways more than they do.
So this product is not available right now. You're basically reworking it, and it'll be
right now sold out.
okay.
In the process of getting a new one, and we'll definitely be announcing that.
Okay. So maybe we have about 5 minutes left. I want to talk a little bit around. This is a conversation you and I have had a lot. DSO, education, coaching, mentoring, and I think they all sort of it fits together, but not just tied to DSO. But let me just jump in to not confuse the audience here. By the way, audience, if you guys have any questions, please put it in the chat or the in the question icon, and we will get your question asked and answered. So we see that corporate dentistry is really taken off. I don't want to misquote the number, but I want to say it's something like 30% of dentistry now is corporate dentistry, and that number is expected to be more like 50% by 2030, something along those lines. I might be, you should probably check my stats there, but directionally we see it's increasing. It's becoming a big part of the way we take care of the population's dental health, and within the implantology part of it. And this isn't just specific to DSOs, it's really general dentists. General dentists are now placing half of all implants. And so, with that, there's a need for education, right? And with the education, I think that there's different levels of what we see going on in the market. And some are really doing really high level work. They're extremely well educated. They're on top of all the latest and greatest. And somebody you would refer your friends and family to, and then some are fairly inexperienced, and I'm not sure even don't know what they don't know yet.
Yeah.
And so when we look at the implant placement, I think especially within that group, we see less grafting, which that's where my bias comes into play.
Sure.
Being president of Osteogenics and a dental bone grafting company is, but also I think about I know that just from being in this industry for 23 years, I know that there's all these different principles. Tarnow and lots of other people have sort of proven a lot of these things of what we need. Like when you can place immediate, when you can't, when you can load it, how much bone you need for long-term survival, how much soft tissue thickness you need for long-term survival, and it's a lot of
Yeah.
information. It's a lot of education that goes into that. And my concern is I think that a lot of the dentistry we see and it really, like I said, it varies a lot, but these principles aren't necessarily known by everyone. So, but the number of implants placed is really kind of taken off with different groups. And so I feel almost like a little bit of an obligation of like, okay, we've got to, and obviously Osteogenics and other bone graft companies will benefit along the way, but we really have to like educate in this way because, we want these implants to last, for a long time. And so that's where we get into the education piece and maybe just your thoughts around that. Do you think I have that right? You think I'm a little bit, maybe my perspective is a little off. I'm happy to hear your perspective there. And then what do we do about it? And then yeah, just what's the solution?
Yeah, I mean, you're hitting a lot of points that are certainly relevant. The numbers are growing exponentially. It's over 500,000 implants a year that are being placed and growing massively. But at the same time, you look at the literature now, after 2 years, prevalence of peri-implantitis, it's been over 20%. It's creeping close to 25, 1 in 4, and that's only after 2 years. And that's as massive as it gets. So I think there's a lot of emphasis in wanting to learn how to pop them in, but in terms of management, hard tissue management, soft tissue management, obviously you're biased from the bone side, and obviously as a periodontist, the soft tissue side is completely ignored, and you look at the peri-implantitis cases, and 3 out of 4 of them don't have any attached tissue. So there's so much with that part of it as well. And at the end of the day, there's so many factors in terms of timing and techniques, and really just as important of placement is just management. You can get a great course and learn, but then it's, how are you going to manage complications? What are you doing to create an actual maintenance program? And so, it's really a matter of, people that are seeking this education, are they in a really involved program? How detailed is it? Certainly the thought of, being able to understand all of these nuances in a weekend or two. I did a 3-year residency, and you still come out and you're still like, gosh, I still don't know a ton of stuff.
Yeah.
So, how could you do that for 3 years and expect, in a weekend or two that's going to pick up? That being said, there are other programs that are out there that are much more elaborate, much more long term. I have colleagues that get involved in that and take a much longer route and take a much more detailed path. And like you said, there's plenty who I would be happy to go and see and get my own work done. So
Yeah.
there's a balance to it, but it certainly rests on the depth of education. And you know what? Just as much as that, it's also learning limitations and knowing, what's kind of within your wheelbox and maybe something that's a little bit outside and should be, maybe seeking additional care, with somebody that's got a lot more under their belt. So,
Yeah.
but it's nothing you can't avoid. It's just there. And I think the best alternative to that is just to try and help from that education standpoint and help people as much as
Yeah.
possible.
And I think also you just bring awareness to it. I think
Yeah.
sometimes it's like, oh, okay, oh, wait, that's an issue. That's something I need to be paying attention to. Maybe that's something I need to learn more about. And then, from like an osteogenics and, standpoint, it's like, okay, well, what can we do to educate on some of these things and try to
Yeah.
help, add value and close the gap a little bit. So I know that you're doing, you've always enjoyed education. You do part-time at Harvard. You've done some other you do a lot of lecturing. I believe you also are starting a coaching and mentoring project that I know you're super excited about. So tell me a little bit about that. What is it? How does it work? And then when does it get started?
Sure. No, super excited to share. So we're going to be launching a coaching program 2025. Going to be launching March 1st, and the program's called Mastering Clinical Confidence in Surgical Cases. So kind of segueing off some of the stuff we even talked about, we talk about clinicians wanting to just boost their confidence, have more of an understanding of, what to look for, how to manage certain cases. We talk about the fact that you'll go to a course and get a little bit of training, but then after that, how much of that do you retain? How do you have an ability to actually be part of a small mastermind kind of community where you can bounce these ideas off, have these discussions, have ongoing lessons, learn new software, new technologies, techniques, all this stuff. So the consequence of this stuff is clinicians are taking all this burden on, and there's a lot of outcomes that don't go as much as the way they want. Production might not be, or success in growth as a clinician isn't growing the way it is. So on my end, being 15 years out as a specialist now, this program will be a 6-month program. We'll be doing coaching calls a couple times a month, and basically 15 years worth of experience, best practices, pitfalls, best technology experience, et cetera, to be able to bring a small kind of mastermind group in there, have this online community where, people can connect with great sponsors like Osteogenics, learn more about these technologies and techniques, and really up their clinical game. And at the end of the day, this is beyond training. This is more of mentorship coaching opportunity for those who are doing surgery and just wanting to really raise their level. This is going to provide them that environment. Like I said, it's the beauty of it. It's ongoing, so it's not a one-time course and now you got to go figure it out. There'll be expanding lessons through different things, all the way from diagnosis through implants, regenerative materials, extractions, post-op management, case closure, all these things that you need to put all those pieces together and create a team and actually be able to sell and execute these cases and diagnose them. So it's really something I'm really excited about. Again, we're going to be launching that on March 1st. And we already got a lot of great sponsors involved. Obviously, Osteogenics is awesome. Looking forward to doing that together as well, and getting people already booking into the program. So we're starting our inaugural group with a little bit more of an intimate group. So definitely not a ton of registration stuff, but wanting to spread word, and obviously if anybody listening in wants to be considered and be part of the group, would obviously love to have you and hear from you. And you can just DM me on Instagram and can get in contact with me directly. It'd probably be the easiest way to just connect from this call, and really looking forward to doing this and helping people out.
Awesome. So yeah, this mastermind program, I'm just trying to recap here. I took some notes. 6-month program. I believe we talked about, I didn't hear you mention it, but there's also like there's like a module learning system that they're doing
Yes.
between calls. So there's a lot of
Yeah.
like digital online sort of education. And then whenever you're meeting together twice a month, there's like basically teaching, but then there's a lot of like interactive sort of sharing of
Correct.
experiences and
Correct. Yeah, the in-person, there'll be interactive, there'll be some case presentation, and obviously the participants will bring, some cases, and we'll work through those. There'll be an LMS module with further educational stuff that they'll be able to get. Some of the finance stuff that we talked about,
okay.
some of the like leadership stuff for offices, patient psychology, sponsor contacts, and training materials from that standpoint. And then when we finish the 6 months, looking forward to planning we'll have an in-person weekend event together. Well, we'll have all the sponsors out there. We'll have some guest speakers, talk about this stuff, some different topics, bring in some, professionals and coaches, and it'll really be kind of this great all-around experience that brings everything together, brings all of the mastermind group together, which will be great for all of us to be in one place and give everybody an opportunity to connect with, companies like yours, and really put these things all together. So it'll be a really cool, well-rounded, all-around experience for everybody.
Awesome. And so the first cohort, maybe that's not what you call it, I don't know, starts March 1st. So,
Early March, yeah.
so less than 4 months away. And for those that want to learn more about it, I imagine is the first step. They should DM you.
Easiest way.
Okay. Awesome. Well, hey, thanks so much for taking time with us. These are topics, this isn't normally things that we talk about on these IG live sessions. Normally it's a whole lot of like, what bone graft did you use? And, did you get primary closure?
Yeah,
And
yeah, yeah.
how do you treat periimplantitis and all these fun things? But this is a nice shift to something a little, a little bit outside of, I think what people hear a lot. And I think that this mental health and wellness topic is like, I see it's really like current right now on Instagram. Is we have a lot of friends that we follow on Instagram, and we really see it. Like if we look in stories, it's like, I mean, it's every day that this is, and like I said, some kind of recent tragic events have sort of like brought even more attention to this, which is sad that that's what it takes, but it also has had the positive impact of bringing a lot of awareness. And I know that this is a topic that you have been kind of on for a while. And so I think the timing of our session here was really good.
Sure.
Well, hey, I really appreciate your time, and thanks everyone who attended. And I'll talk to you soon.
All right. Thanks so much. Thanks, everybody.
Bye, Sam. Bye,
See you.
everyone.
Have a good one.
Bye.